Welcome to the third annual Q&A Mesothelioma Ask the Nurse series with nurses Ericson and Lisa Hyde-Barrett. Lisa has been a thoracic surgery nurse for nearly 25 years and has the skill and knowledge to care for and support mesothelioma patients. She is currently at a major teaching hospital and mesothelioma center. Through her work, she has helped ease the stress of patients and their families by offering a comforting hand. She is passionate about helping the mesothelioma community. Ellie is a graduate of the Mount Auburn Hospital School of Nursing and Worcester State College and has worked in the surgical intensive care unit at a major teaching hospital and mesothelioma center for more than 30 years. We welcome both experienced nurses and thank you for your time. We also have Charlene H. on the call, and she is an experienced mesothelioma social worker. She has worked with mesothelioma patients and families for over 10 years. Charlene, we're going to direct the first question to you.
Okay.
What does a social worker do for a family going through mesothelioma?
Okay, so social workers do lots of stuff, lots of different stuff for patients and families dealing with the diagnosis of mesothelioma. The first, and I think the most important piece that social workers can offer is to take care of the emotional side of a diagnosis like that. It's one of those diagnoses that people get all of a sudden, so it can be very scary. And so we need to really pay attention to what's happening emotionally so that we can sort of take care of that piece and people can then get through their treatment. So that's a major piece that we do. Is there more you'd like me to say about that, or specific questions?
Charlene, tell us a little bit about you form such special relationships with these patients. Lisa and I have seen it over all these years. And how do you think you're able to do that where a lot of other people aren't able to do it?
Well, yeah, I think that is really, really important. You know, it's a long process. And so when I work with folks at a hospital setting, I really try to connect with them on a daily basis to check in, to see how things are going. And we not only pay attention to the patients because they clearly are very important, but the family members are also very important. Mm-hmm. Caretakers can really be under a tremendous amount of stress because life doesn't stop for a caretaker just because their loved one has a diagnosis. They still have to continue to run their family and work and whatever they might do or have to do. And so we really want to pay attention to the caretakers and address the stress levels. So I do that by meeting with them on a daily basis, both the patients and the family members, checking in emotionally, kind of taking a temperature, if you will, in terms of where they are, and providing support, emotional support all the way through. And we do this by, I run support groups for them, which is really important. Run a support group for just caretakers because their issues are different than the patient. And so those are some of the ways in which we do that. We also do pay attention to some of the concrete needs that people need because that's important too. Some people have to travel a great distance to get treatment. So that can be taxing, not only emotionally, but also financially. So we address some of those issues and try to lessen that burden by helping them find housing or flight information, anything that will help reduce their stress so that they can pay attention to what is most important.
And it is very stressful, right?
Yes, extremely so, yes.
Yeah.
So Charlene, what would you say one of the biggest stresses is traveling, like if you have to come state?
Yes, I think that's huge. Yeah, it's expensive, but it's also sort of the whole uprooting piece. And when you do come for treatment, it's not, you do have to come for a length of time. And you're told that up front, but, no one can give you sort of an end date of when the treatment is over. And that can be extremely stressful. It's not a time-limited stress. It's sort of a chronic stress, and you have to sort of figure out how to deal with that chronic stress and how to take care of yourself. And being far from home, you don't have your natural support. You don't have your own family next to you. So the social worker becomes one of those support people. Mm-hmm. Not that we take the place of family, but we are there by your side in those times that can be trying and difficult.
Okay.
Yeah, and you see every patient, right? Because I think
Yes,
that's
every
important.
patient, just about every day.
Okay. Is it common to treatment centers and hospitals to have a social worker? Or it
Yeah, I think
depends?
I think most major teaching hospitals have social workers employed there, and because it is such an emotional, there's an aspect of emotionality that is so important. So I would say most likely yes. I don't know for sure, but I would say probably yes.
Okay.
You know, and like you said, it's really kind of a journey. You know, they start, patients start with this strange diagnosis, and then there's so many ups and downs, and, and what we've seen, too, is that a lot of the patients get very close to each other, and then, their path may take, one may do very well and one may not. And, can you talk a little bit about, like, that,
Yeah, I think that's a really important point. Patients come out here, and they do form bonds with each other, very close, the family members especially. And, and so to put it bluntly, some of the patients don't make it, and it's really difficult for the bonds that they have made and for those folks that are here with them, because they do become like family. All of them are kind of away from home, and they're wherever they are, whatever center they are, they form bonds and become really close to each other, support each other through all the tough times. And so it can be hard when they lose a loved one, but also a friend that they've made. So that can be really tough. And then it's the guilt that goes along with that. My loved one made it, but your loved one didn't, and how do I cope with that? And it can be really tough.
Yeah. I think we've seen that more and more about, when patients do die, and how, you have this tight emotional bond with this group of people that you probably didn't know, 6 months or a year before. And then all of a sudden, your loved one has died. We kind of leave the caregivers out there, Nobody else knows what they've been through, their, family members, except for that support group that they had.
Right, and I think that holds true for sort of extended family members. Like if a wife comes out here with her spouse and they have children, and the children aren't able to come out because just financially it's not feasible, we see that a lot, that the children might come out at the very end, and the wife has gone through this entire journey, and the children are sort of coming in at the end piece and haven't processed this whole thing through. And really the spouse ends up becoming more bonded with the other spouses that have been here with her throughout the journey. So that can be a very difficult piece to deal with.
Yeah.
I bet.
Yeah. And Charlene, can you talk a little bit, too, about, like, complicated grief as far as, like, mesothelioma goes?
Yeah, I think a huge piece of it is around guilt, where some people get it and some people don't. And why did you get it and why didn't I? And how come, if it's a husband and a wife or whatever, and there was exposure, that we see that a lot. And then the grief is not just about grieving about the loved one dying. It becomes complicated by this whole guilty factor. And that can be really, really difficult. And it's hard to, and that's why we run support groups that are separate, where patients might have their turn to talk and spouses have sort of their own group, because their issues are different, and they have to be able to say that. I feel guilty. I feel bad. I can't tell you how many spouses I've heard say, I wish it was me. I wish it was me. We were both exposed, but I wish it was me, and I wish it wasn't him, and I feel so guilty, and I feel so badly. And so it's really hard to grieve the death when you are also trying to grapple with your own guilt around that.
Mm-hmm.
Yeah.
So what do you do with it, Charlene, if you're the widow of somebody who passes away?
Yeah.
Is it
right? I think you have to really pay attention to what's happening, and we talk with spouses all the time. Oops, sorry. Once you're done with me or whomever the social worker is in the center, and you go back home, really, really encourage people to either get their own counselor or therapist, try to join a group. Some people are really great joining groups. They feel comfortable. Others just don't feel like they can share their grief with others. Others are just not ready to do that, and that's okay. But I think they really need to get a professional person to talk with. because everybody experiences this in their own way. Some cope really well, some do not. And then they also have, aside from all that piece, they then have the concrete needs that they need to go home to. Now if their spouse died, maybe they can't afford to stay in their home. They need to sell their home. They need to figure out what to do. So there's just the levels of stress it's multi-layered, and so they really need the support of a professional to sort of help them figure out how to navigate that and where do I start.
And on top of all that, you still have all these medical decisions that people, have to decide, where to go, or if they should go anywhere, or if they should get involved in a clinical trial, or if they shouldn't, And
right.
You also, have that, and I think a lot of people kind of go over and over that in their head when things don't go well. They second guess everything that they've decided,
Right. Right, and we try to talk with people, you've made the decision to be here, and so we need to kind of go forward and try not to revisit those decisions. We tell people you've made that decision, so let's go forward and put our best foot forward and try to keep looking to the future to see where we go. But people do second guess themselves a lot, especially when it doesn't go well. And that's another piece that comes in the guilt. My husband did this for me, and now he didn't do well. I wish I had never talked him into this. I wish I had never done this. So, if social workers can get to folks even before they decide what they're going to do around the process, those are some of the issues that I would bring forward. How did you make this decision together? How did you come to it as a couple? Because if you can do some of that piece, you don't get some of those complications at the end.
Mm-hmm.
Yeah.
Good, nice.
We've seen Charlene in action. You just have no idea how many people depend on her, and and all the support groups. They really enjoy those support groups because it gives them all time to talk and to let out their issues.
Share their feelings.
Yeah, it's amazing.
I think the other piece that becomes difficult too is when there are young children involved, and we've had many cases where there's been younger kids involved, and I think family really grapples with how do we help the kids get through this as well. So you have the spouse that's trying to get through this and navigate this, and then you have some young kids, and they have to either, do we bring them out with us, do we leave them home and continue with school and their normal routine, and how do we work with them, and that can be very, very difficult. And if there are young children involved, there are special and different ways to talk with kids depending on their developmental age and what is appropriate to say and what isn't appropriate to say. And, when do you bring them out to see whomever it is, and when don't you, or grandchildren, whatever it may be. So that can be another piece that the spouse or the caregiver, whomever it may be, again, more decisions that have to be made for the caregiver. So there's just a tremendous amount that they have to do.
Mm-hmm.
Yeah, Lisa and I were talking today. We were thinking, it really is all different ages, from the youngest that we can remember was, 18?
Yeah.
So it's just not, middle-aged couples that are going through
No.
it. Families. It's amazing.
Yep. And, we've seen, as you guys know, we've seen more women diagnosed with it as well. And that's the whole dynamic for the husband, where now maybe most, normally the wife is usually the caretaker in the family, and now those roles become reversed. And it's very difficult. I've seen a lot of men really struggle with, either that caretaker role or figuring out what to do. How do I help my wife? She was always the nurturer. How do I get through this, and how do I support her? They're kind of lost in that process. So that's another piece that I would, kind of sit with them and help them think about that, and, how do we do this? And acknowledging, yes, it's a role that maybe you've never played before. It's probably really tough, but we can get you through it.
Yeah.
And staying on the topic of age, I had a question. How young can people develop mesothelioma?
Well, I think the youngest we've seen is 18, right?
Yeah.
Yeah.
Have you seen younger, Charlene?
Yeah, I've seen the youngest I think I ever saw was 18.
Yeah.
Mm-hmm. Yeah.
I think I'd heard of a case of peritoneal meso, a little younger, but I never saw it. 18 was the youngest that I think we've seen.
Yeah.
Mm-hmm.
And, you know, that's very young to try to figure out.
Such a terrible disease.
Yeah.
Yeah.
Really. Yeah. And, you know, because the usual incubation period for meso is, what, 20 to 50 years? So, it's,
Yeah.
Right.
you know, kind of flies in the face of all that.
Right.
It also has its own thing. But, I think Charlene is, a social worker is just a vital part of the whole team. And I think that's what people need to hear, that they have to be comfortable with their team. You know, they have to, want, they have to really just be comfortable, that they are being well taken care of. Right.
And I think people should seek out the social worker whatever team they go to. I mean, we are most places, so I think it's really important that if someone doesn't seek you out, that you seek them out, because if you don't pay attention to the emotional piece, it's really hard to heal. It really is. It really goes hand in hand with the physical healing, is the emotional piece.
Absolutely.
So, Charlene, just a quick question. So Ellie and I obviously see patients after they leave the hospital, and, oftentimes they might be at a hospitality home or wherever. Yep. And it seems like there should be a social worker involved, but at that point they're kind of moving forward to getting home.
Yeah.
And is there a bridge to, from hospital to home for some help?
Yeah, that's always a tough piece. One of the things I usually tell people is to, when they do get home, because, we take quite good care of them when they are with us, wherever they may be. If there's a social worker, they're going to be taken good care of. And people feel very held and taken care of. And then when they go home, I've heard people say, oh, we sort of feel abandoned because, we had all this support, and when we go home, we don't have much. So I really encourage people to connect with their local cancer centers, wherever they may live, and connect with the folks there. 9 times out of 10, there's a social worker, there's some kind of a group. It might not be specifically for mesothelioma, but it could be for something else that might be appropriate for them. So I really try to tell people to reach out and do that and not be so isolated with it. Because, as you know, it's a really rare disease, and sometimes they can't find anybody else diagnosed with it. When they come to a center, it doesn't feel so rare, but when they go home, it does feel like that again. So it's trying to help them not feel isolated and to reconnect with a cancer center, in their local community.
Okay.
And there are resources out there, right, selling, but, from the social worker point of view, for, as far as like the Hope Lodge and, different places all across the country.
Absolutely.
Centers.
Yeah.
Because I know you do a lot of that too, a lot of helping connecting families with, different resources.
Yeah. Because it's so isolating, and when they get home, they just really need to try to pick up their life as best they can. It's not always the same; it might be different, and we sort of call it the new normal. It might not be exactly what it was like before, but that's okay. And there's a whole adjustment period, and within that adjustment period, they need support around that. So they really do need to connect with their local cancer centers or whomever to get that support. Because oftentimes they've sort of tapped out their family, and so I always tell them to really try to turn to professionals, because that's where it would be helpful for them to go.
Yeah.
Yeah.
Charlene, sorry.
I'm sorry.
Go ahead.
Did you find the meso patients, just because of the rarity of it, do you find a huge difference between their experience and someone who might, say, have lung cancer? Or?
Oh, yeah, very much so. I think because it's so rare, oftentimes the patient who's diagnosed with it has never heard it before until they've had a diagnosis. And so it's so frightening. They have no idea what it's about. They have and they don't know other people who've gone through it, where other maybe lung cancer survivors might know someone else who's gone through it, and they've gotten through it, and they've been okay, and they've gone on to live a, a decent life with mesothelioma. If you don't know anything about it, you don't know anyone who's had it, it's really hard to sort of be hopeful and think of what the future might hold. So it's really scary.
Yeah.
And then I think when they do find out what it is and they start to do research, then it becomes oftentimes even more scary because they read dire statistics, but and we always tell people try not to do that. So when you go to the center, wherever it is that you may go, and you talk with the doctors and you find that it's more hopeful to try to stay focused on what your team is saying versus maybe what the internet is saying, because it gets very, very confusing for people.
Yeah.
Yeah.
I guess, and showing how important your relationships are with these people.
Pardon me?
Kind of shows how important the social worker's relationship is with the patient.
Yeah, I think it is. We really try to guide them through the whole process and sort of help them interpret a lot of what the docs are saying, because that sometimes can be overwhelming, trying to sit in on meetings with doctors and patients and families to sort of help interpret that. So when the docs leave the room, we can sort of say, did you get that? Did you understand that? What other questions can we help you with? When things aren't going well, trying to help them be more assertive and aggressive in addressing the team and really trying to get their questions answered, and just kind of being parallel with them in that process and trying to help them navigate that whole piece.
Yeah.
I did have one other question. When we were talking about the guilt that the surviving spouse has from someone who has passed from mesothelioma or has been diagnosed,
Yep.
is the spouse that survived, is that spouse still at risk? And does he or she need to be tested regularly for mesothelioma?
Oh, that's a good question. I don't know. That's a Lisa or Ellie question.
I think if they were exposed to asbestos, they could, if they're developing symptoms, but you can't just catch it because you were with somebody who has mesothelioma.
Mm-hmm.
You have to be exposed to it. You have to have almost like predisposed. Because some people who are exposed to asbestos don't get mesothelioma.
Most people, though, that are exposed to asbestos don't get meso. So it's, there really
Right.
isn't.
There's only 3,000 cases. What, Ellie?
There really isn't a screening test. People are always asking
Right.
that. There really isn't anything.
Mm-hmm.
Because it's such it's so complicated, all the different, all the reasons, it's very complicated. It's a complicated disease, it's a complicated diagnosis, and it's complicated treatment. I mean, and progress is being made on all of those fronts, but it's still complicated. So,
Right.
there's really no screening tool. I mean, they've been, again, working on different things, but, nothing. I guess one of the big things, I heard one of the mesothelioma physicians say about 10 years ago, and I always remembered it. He was talking about, progress that was being made. He said, you have to remember, within the last 15 years, it's just gotten to the point that, like, probably 15 years ago, if you had mesothelioma, that was the only criteria to enter into most of these clinical trials. Now, you have to have a lot of them are much, much more specific. You have to have a certain subtype of mesothelioma. You have to have, you have to have gone through treatment or not gone through treatment, whatever the clinical trial,
Right.
is going. So it's kind of evolving, but it's really, you're not at the point where you could, there's a simple screening test for it.
No, there's no screening test.
Okay.
Yeah.
My next question is, does asbestos travel on clothing, and is there a possibility of secondhand exposure?
Yes, it does travel on clothing, and that's how a lot of people or younger people get asbestos, is that maybe their parents brought it home on their work clothes, and maybe the child, hugged the father and he had it on his work clothes, and it, repetitively did this. So yes, it does travel, and there is secondary exposure.
Yeah, we've had quite a few patients that have, been exposed by doing, the wife might have been exposed by doing the husband's laundry or different things like that. And, they're also looking into that a little bit further because there are some, most people can be exposed and not develop mesothelioma. So what makes the subset of patients that do develop mesothelioma, what makes them susceptible to meso? If they have the same exposure as other people. So that's why they're looking at the different genes and different different variables to see what is the commonality of it all.
Right.
And, the asbestos, it's still in the it's all over the place. It's still in the United States. We still use it for, different things, brake linings and things like that. It's not illegal in the United States. And, and
older homes.
Yeah, a lot of homes, especially up here in the, we're in the Northeast. And, a lot of it is used for insulation in older homes. And they're also seeing a great, a big, England and Australia are, have a lot of mesothelioma, as does South Africa. And, a lot of places that, developing third world countries because they're, they're still using it.
It's cheap.
They're, they're still being exposed.
Right. It's inexpensive to use.
Yeah. Inexpensive, and And it was only, last year that Canada opened their mine again, and then I think they did close it, but they had it open again, and they were exporting asbestos to China and to, South Africa, So I guess the good news is there's a lot of work being done,
Yeah.
What constitutes exposure to asbestos? Is it inhaling or ingesting?
Could be both, right?
Yep.
There's some theories that, you inhale it and then it's dormant. And it's something triggers it to develop into meso, into the beginning things of mesothelioma. If you talk to a lot of patients, a lot of times, they're fine, and then all of a sudden maybe they had an accident or they fell, or, something, they don't know just what in the body seems to trigger it, these things.
Right. Well, they developed acute onset of shortness of breath.
Mm-hmm. A lot of them too were diagnosed by people thinking that they had pneumonia. They think they have pneumonia, and that would be the common. It's not that that would be the most common thing to have. Of these symptoms, it's reasonable to say that it was pneumonia, right?
Yes, absolutely.
Yes.
Everyone starts out with a pneumonia diagnosis, and then when it doesn't go well, evaluation reveals meso.
Yeah. And it takes a while. It's getting quicker, but a lot of times the initial biopsy might be negative, and then they keep at it, and then maybe it takes 6 months to finally get the diagnosis of mesothelioma.
And also, the physician that they might be dealing with has never seen mesothelioma, so he might not be aware of the characteristics of what the disease might pose. So it's really very far removed from, a diagnosis.
Okay. So you would recommend finding different opinions or getting different opinions when you have, those types of symptoms?
Well, not everybody who has pneumonia is going to have meso.
Yeah. Mm-hmm.
I mean, you go to the doctors with shortness of breath, it's probably one of the, they say, oh, you think you have pneumonia when they do a chest x-ray, and, they send you home with some antibiotics. I think it's a pretty routine thing. I don't think someone's I think it seems obvious that you would treat. Wouldn't you agree, Ellie?
Yes, yeah. See, I think, like Charlene said, we see so many patients with mesothelioma, you start thinking that it's very common. And it's less than 1% of all the cancer diagnoses in the United States, less than 1%. And there's 100 times more patients that have lung cancer. And, so it would be, their differential diagnosis probably would start with pneumonia, and then you'd go from there. I think the most important thing is that you have to, wherever you get treatment, you just have to be comfortable with your team. You have to be comfortable with, because all of the centers in the United States, you need a thoracic surgeon who's an expert on it. You need a medical oncologist that sees mesothelioma regularly. You need a radiation oncologist. And all these people all come together. You need specialized nurses. You need social worker that knows what the journey is going to be like. So I would say most of all the centers in the United States have those things. But if you're not, you have to just feel comfortable with your decision, and you have to feel comfortable that the people, that you're dealing with, you're at peace with. So I think it's really important as far as, like, if you feel you need to get a second opinion, then, go for it, because, again, I think it's just vital that you're comfortable with the team. And,
Right, you have
people,
to be comfortable.
right, people sometimes are like, kind of skittish about getting a second opinion. They don't want to hurt anybody's feelings. Everybody was so nice and all that. And it really doesn't hurt anybody's feelings. It's really what you're, it's really what is going to benefit you. That's what everybody wants. They don't, it doesn't really, it's more, that's the most important thing.
Mm-hmm.
Yeah. So I'm going to sign off, if that's okay.
Yes.
Thank you so much.
Oh, sure. Thank you.
Okay.
Thanks for joining.
Bye. Okay, thank you.
Bye.
Thanks. Bye.
My next question is, what is the difference between pleural and peritoneal mesothelioma, and are those the most common types of mesothelioma?
Okay. The difference is the location. Pleural mesothelioma is the lining of your lung, and the mesothelium is one of the linings of it also lines your abdomen. So peritoneal mesothelioma is in the abdomen. The treatments are different, and I would say the success rates are a little different. I think peritoneal meso, it has a better survival. Wouldn't you say, Lisa?
I would agree, yes.
Yeah. And peritoneal meso is, your abdomen, and that is seems to affect, I would say, more women also than
I would agree with that as well.
In pleural meso is more, although definitely women, but it's 2 to 1, I think. Men are more affected by, peritoneal, by pleural meso.
Okay.
I guess there's like 4 different places that you can have mesothelioma. The most common one is pleural, the lining of your lungs. The second one is peritoneal, the lining of your abdomen. And the third one is testicular, a very small percentage. And it's probably 1 or 2 cases a year out of 3,000, or maybe 4 or 5, but not many more than that, of cardiac mesothelioma. And that, as far as treatment goes, is very difficult to treat. So they both have the major ones, peritoneal and pleural. They have different treatments for them, and there's experts in just peritoneal and in just pleural.
Mm-hmm.
And, you know, sometimes too, like it seems like the hyperthermic chemo kind of started with Peritoneal, and then they've been trying it in Pleural. So, you know, they do, you know, some of the treatments might look the same, but they're just different energies. So.
Do you know any specific drugs that are being used to treat, that are immunotherapy being used to treat mesothelioma?
So as of right now, there's clinical trials, and if you go on clinicaltrials.gov, I actually found 3 trials that were posted that were still actively recruiting, which means they're accepting patients. One of the trials was ages 18 to 70, and each trial has its own specific criteria to be able to enter into that program. Most, there's no immunotherapy drug that the FDA has approved. It's all in clinical trials. So there's one at the NCI in Washington. No, is it Washington? NCI?
Yes, yeah. But
Washington. Then there's one in the Netherlands, which is ever so convenient. And then the Fred Hutchinson Cancer Research, which I exactly don't know located. But those were the 3 that were actively recruiting for people who want to enroll in immunotherapy. But nothing's been approved by the FDA as of yet.
Mm-hmm.
Okay, so I just, immunotherapy itself is a type of cancer treatment that the people are they're trying to develop that uses the body's natural defenses to target the cancer. So they're trying to, like, trying to boost the immune system either by, either by doing something in the laboratory, by taking a pill, or doing something to improve your immune system so that will in turn fight the cancer cells.
Right, so the body will attack the individual cancer cells.
Yeah, it's more of a natural defense of cancer. That's the whole idea behind it.
Yep.
When Lisa was saying about the clinical trials, that's where progress is going to be made. And that's where progress has been made with meso. Is these clinical trials, and luckily there are quite a few of them now, as opposed to a few years ago when there weren't so many of them. And that's
right.
That's one of them.
There are quite a few clinical trials. If anyone's interested, clinicaltrials.gov, and it gives you a box where you can pop in mesothelioma, and then it lists all of them. And I would. There's a lot, and I think that you could, probably arrange something if you want to be involved with one of those clinical trials. And, truth be told, it helps everybody.
Yeah, yeah. And it's the only, it's the way it is. Everything's gonna progress is if people get enrolled in clinical trials. And for, the statistics across the country is it's less than 5% of all cancer patients enroll in clinical trials.
Yeah, it's really minimal.
It's very,
and that's where we get our knowledge from.
Yeah, that's where progress is going to be made. And I think some of the reasons that people don't enroll in them is because a lot of times I think they get afraid. You hear something on the news, or I was at a conference a couple of weeks ago, and there were patients there, and they said, well, why would I enroll in a clinical trial? I'll end up being a guinea pig. And it's like, well, no, that's not how it works. But that's common. That's not uncommon for someone to think like that. The clinical trials, everything has to be informed consent. You have to understand, exactly what you're signing up for and what you're not signing up for.
Exactly.
And all right, so for instance, this command trial that they just stopped, that was a trial. All the patients knew exactly what they were signing up for. It was a trial that was, you had to meet the requirements. It wasn't like you were going to be, quote, unquote, a guinea pig, because in order to do it, you had to have already had the conventional therapy. And then they were doing this in addition to see if it could see if it could hold off, if it could hold off reoccurrence. And there's just so many different facets. You just can't, say, I don't want to be in a clinical trial because I don't want to, I won't get the best treatment. It's just not the fact. So again, comes back to that full team. You go talk to your oncologist, you talk to your surgeon, you see what's available, what they would recommend, because they all, do work together, and it's such a small population that, they might know of a clinical trial, or they might know of someone that's going to be starting a clinical trial, and then, you'll be able to get involved in that.
Mm-hmm.
My next question is, what is the best comparative cancer treatment to look at that might help guide me and my family? What is the relationship to melanoma?
So the relationship between mesothelioma and melanoma, I think they started working on this back in 2011, and it's the BPAP1 gene, so it's BPAP1, and they noticed that some characteristics were the same, that if you were exposed to asbestos and you had this gene, you were more apt to get mesothelioma. And if you had this gene, you were more apt to get melanoma of the eye as well. They're still continuing to do research. I really don't know if there are any other characteristics besides that major one. Ellie, do you want to say anything about that?
Yeah, isn't it like a gene? They're looking at it as, like you said, Lisa, the same kind of mutation that's in one, that's in the other. It's something that, research has kind of just brought up, recently. But, it's I'm trying to think of, as far as another, there are some other aggressive cancers. Mesothelioma is an aggressive cancer. There are some other rare aggressive cancers, but none that I can think of really that, kind of mimic this. Can you, trying to, I guess the other point, too, that we haven't made is that, some people seem to do better than others, and they're not sure why that is. Some people with the same type of mesothelioma, there are, 3 different types, and some people, seem, live, a longer time, 5, 7, 10 years, and others with the same type might not. And that's, again, that's what they're working on.
Okay. I think Lisa went offline. Maybe she's having problems. But we only have one question left. I don't know if we want to touch on this. Why do Navy veterans make up a large portion of the cases? And veterans, what options do they have? Do they need to go to specific VA centers for treatment, or?
Okay. All right. So veterans make up about 1/3 of all mesothelioma patients in the United States. That's there's 3,000, so about 1,000 a year. The reason is probably the shipyards, Navy people, the asbestos in the boiler rooms, and in different, cargo carriers, different areas, but mostly, the shipyards and different things like that. So there's a third, so 1/3 of all of them, all the veterans will, 1/3 of all the mesothelioma patients will be veterans. The VA has done a lot in the last few years to acknowledge the veterans, and they've actually fast-tracked it. So if you were in, if you can prove your exposure, which they have made easier to do, then it's easier to get some help, compensation from the government. There are, in Boston, I know there's Dr. Leventhal. He is he works at the VA in West Roxbury, and he has mesothelioma veterans coming to see him from around the country. I think there's another one on the West Coast, but you have to with the VA you have to just kind of push a little bit, but it's been much more responsive in the last few years because of the and like I said, it has been fast-tracked for veterans benefits. So,
Okay.
but yeah, it's been 1/3 pretty much for many years that are veterans, and unfortunately, I don't know if a lot of people connect that. They explain it to them, but it's kind of hard to believe that 20 to 50 years later, your service that you gave to your country is now coming back to kill you.
Yeah.
Well, I think it's about time to close out this year's Q&A session. I want to thank you, Ellie, Lisa, and Charlene for taking the time out of their evenings to provide us with more information about mesothelioma. If you would like more information about the disease, please visit mesotheliomahealth.org, and I hope everyone has a great evening.
Yes.
Okay.
And
Thanks very much.
And Lisa and Ellie have a website, themesonurse.com. Is that correct?
Yes. Yeah.
Okay, so you can find more information there too.
Yes.
Thank you very
All right.
much.
Thank you very much.